Why chest pain happens, the body's alarm system. Chest discomfort is not random, it is a biological warning signal. The chest contains vital organs including the heart, lungs, esophagus, and major blood vessels. These structures share nerve pathways that send alerts to the brain when something is wrong. Pain, pressure, or burning occurs when tissues are deprived of oxygen, become inflamed, or are placed under abnormal stress. Because these organs share nerve networks, your brain cannot always identify the exact source. That is why a strained muscle can feel similar to heart-related pain. Cardiologists explain that chest pain is one of the body's most sensitive danger signals. It can represent anything from minor irritation to life-threatening loss of blood flow. Understanding the pattern is more important than identifying the exact cause on your own. How heart problems cause chest pain. When blood flow through the coronary arteries becomes restricted, the heart muscle receives less oxygen. This condition, called ischemia, produces the deep pressure-like discomfort known as angina. If blood flow stops completely, a heart attack occurs. People commonly describe heart-related chest pain as a heavy pressure or squeezing sensation, discomfort in the center or left side of the chest, pain spreading to the arm, jaw, neck, or back, a feeling of weight or burning that worsens with exertion. This type of pain must never be ignored. Dangerous chest pain you should never ignore. Certain patterns consistently require immediate medical attention. 1. Pressure or tightness in the center of the chest. This is the classic cardiac warning sign. It feels like squeezing or heaviness rather than sharp pain. It may spread to the shoulder, arm, jaw, or back. If it lasts more than 5 minutes or worsens with activity, treat it as an emergency. 2. Chest pain with shortness of breath or sweating. When discomfort occurs with breathlessness, dizziness, or cold sweating, it may indicate a heart attack or a blood clot in the lungs. Combination requires urgent medical care. 3. Sudden severe tearing pain. A sharp, ripping sensation that radiates to the back may signal an aortic dissection, a rare but deadly condition involving the body's main artery. Immediate emergency response is critical. 4. Pain that worsens with breathing. Sharp pain that increases when inhaling deeply may indicate lung inflammation or a pulmonary embolism. If breathing becomes difficult, seek emergency evaluation. 5. Chest pain with nausea, fatigue, or back pain. Heart attacks do not always present dramatically. Women, older adults, people with diabetes often experience subtle symptoms. Persistent discomfort that feels like indigestion should never be ignored. Any chest pain that lasts several minutes, spreads, or appears with breathing difficulty or sweating should be treated as a medical emergency. Common non-dangerous causes of chest pain. Most chest discomfort is not cardiac in origin. However, distinguishing harmless causes safely requires understanding their patterns. Muscle or chest wall strain. Pain from muscles or cartilage is usually sharp and localized. It worsens when you press on the area or move your upper body. Rest typically improves symptoms. Acid reflux or heartburn. Digestive chest pain produces burning behind the breastbone, often after meals or when lying down. It may improve with antacids. However, severe first-time heartburn should always be evaluated medically. Anxiety or panic attacks. Stress can create real physical symptoms, including chest tightness, rapid heartbeat, and dizziness. These episodes often peak quickly and improve with slow breathing. True heart pain usually does not improve with relaxation. Nerve or rib irritation. Brief stabbing pains lasting seconds and not linked to exertion are usually not cardiac, even when symptoms appear harmless. Medical evaluation is the safest way to confirm. Key signs chest pain is coming from the heart. Learning these patterns can help identify cardiac risk early. Pressure, not sharp pain. Heart pain feels deep, heavy, and persistent. It is rarely pinpoint or surface level. Pain that spreads. Cardiac discomfort often radiates to the arm, jaw, neck, or back due to shared nerve pathways. Associated symptoms: shortness of breath, nausea, sweating, dizziness, or a sense of impending doom strongly suggest heart involvement. triggered by activity or stress. Pain appearing during exertion and improving with rest may indicate angina, the heart's early warning signal. Lasting more than 5 minutes. Persistent or recurring chest discomfort must always be treated seriously. When these signs appear together, immediate medical evaluation is non-cardiac causes from other organs. Chest pain may also originate from lungs, digestion, or muscles. Lung-related pain is often sharp and worsens with breathing. Pneumonia, pleurisy, and pulmonary embolism are possible causes. Digestive causes include acid reflux, esophageal spasm, and gallbladder disease. These often relate to meals rather than physical activity. Musculoskeletal pain is reproducible with movement or pressure and typically resolves with rest. Although many causes are harmless, persistent pressure, like pain, always requires professional assessment. What to do when chest pain occurs. Knowing the correct response can save a life. Step 1. Stop activity immediately. Sit down, remain still, focus on slow breathing. Physical exertion increases heart strain. Step 2. Call emergency services. If pain lasts more than 5 minutes, spreads or occurs with other symptoms, call emergency help immediately. Do not drive yourself. Step 3. Take aspirin if approved. You are not allergic and have medical approval, chew one regular aspirin. This may help slow clot formation. Step 4. Loosen clothing and stay calm. Slow breathing helps reduce stress on the heart. Step 5. Begin CPR if needed. If a person becomes unresponsive, start chest compressions and use an AED if available. Step 6. Track symptoms. Note when the pain started, what it feels like, any medications taken. Step 7. Seek evaluation even if pain stops. Heart symptoms can come and go before a major event occurs. Early action saves heart muscle and improves survival. Many heart attacks do not occur without warning. The body often signals distress through subtle symptoms before a major event. Recognizing these early signs, the same awareness principles discussed in our videos on silent artery blockage and heart warning symptoms allows intervention before permanent damage occurs. Education is prevention. Understanding symptoms transforms fear into informed action. Chest pain is one of the body's most important warning signals. Sometimes it is harmless. Sometimes it is life-threatening. The difference lies in recognizing patterns and responding quickly. If discomfort is heavy, spreading, persistent, or accompanied by breathing difficulty, act immediately. If symptoms are mild or uncertain, seek medical evaluation for reassurance. When in doubt, check. You will either protect your life or gain peace of mind. Both outcomes matter. This content serves educational purposes exclusively and does not replace professional medical consultation, diagnosis, or treatment. Always consult qualified healthcare providers regarding any medical concerns or symptoms you experience. If you found this information valuable, consider sharing it with others who might benefit. Awareness about recognizing chest pain symptoms and understanding appropriate emergency responses can make a critical difference in outcomes. Someone in your circle may need this knowledge today. Thank you for taking the time to learn about this important health topic.